Hey, welcome. So you're starting your career in healthcare, which is a huge deal. You know it's going to be a marathon, and honestly, figuring out the mental health side of things can feel like one of the toughest legs of that race. That's why we built this guide. Think of it as your first year's survival kit for the essentials you're going to face. All right, let's get into it.
You know, we spend all this time learning how to check a patient's temperature, their blood pressure, their heart rate, all the physical vital signs. But what about the mind? And that's really the big question we're tackling today. How do you take something that feels so personal and subjective, like anxiety or depression, and actually assess it like a professional? Well, we're going to show you how.
So here's what's in our toolkit. First, we'll talk about how to measure the unseen. Then, we'll get into the very serious topic of restraints. After that, we'll cover your absolute duty to report. And finally, we'll break down how to decode suicide risk.
All right, let's jump into our first tool, and it's all about one thing, measurement. Because think about it, you can't treat what you can't measure accurately. And that's where these standardized screening tools come in. They are going to be your new best friend.
Okay, so let's break down some of these Q tools you'll be using constantly. You've got the PHQ-9, that's your go-to for depression. The GAD-7 does pretty much the same thing but for anxiety. Then there's the CAGE questionnaire, which is a super quick screen for alcohol issues. The MMSE or MoCA, those help you screen for cognitive problems like dementia. And the C-SSRS is absolutely vital for assessing suicide risk, which, yeah, we'll talk more about in a bit.
And this quote just hits the nail on the head. See, these aren't just checklists you're running through. They actually turn a patient's personal feelings into objective data that you can work with. This means you can track their progress, you can talk clearly with the rest of the healthcare team, and you can give much better care. It's a total game changer.
Okay, next up, and this is a really serious one. We're talking about restraints. This is one of those topics where the weight of responsibility is huge. You are walking this incredibly fine line between protecting a patient's safety and protecting their human rights. And you can see the dilemma right here, can't you? On one side, yes, sometimes restraints are needed to stop a patient from hurting themselves or someone else. But on the flip side, if you misuse them, you can cause serious physical and psychological damage. It is an unbelievably delicate balance.
So how do you handle this? With a super strict protocol. There's no winging it. It's called the rotate and release protocol, and it's non-negotiable. Every 2 hours, you release one restraint at a time. While it's off, you're checking their skin, you're checking circulation, you're helping them with range of motion, and maybe most importantly, you're asking, is this even necessary anymore?
Okay, this next number, you need to burn this into your brain. 24 hours. For an adult patient, a restraint order is only good for 24 hours. And here's the kicker. A nurse cannot renew it. Nope. A provider, a doctor, an NP, a PA has to physically come and assess the patient in person before a new order can be written. No shortcuts, no exceptions.
And look, if you forget everything else about restraints, remember this one thing. You try de-escalation first. You try redirection. You try medication. You try everything else in your power first. Restraints are, and they must always be, the absolute last resort.
All right, tool number 3. This one's about your legal and ethical duties. As a healthcare professional, you are what's called a mandatory reporter, and you absolutely have to know when this duty kicks in.
And you gotta know the law is super clear on this. You are legally required to report any suspicion of child abuse, elder abuse, or the abuse of any vulnerable adult, basically anyone who can't fully care for themselves. Now, for domestic violence, here's the key detail you need to remember. You are required to report it when there is an injury. If someone can't protect themselves or they've been injured, you report. It's that simple.
Now, here's a type of elder abuse that you might not immediately think of, but it's crucial to have on your radar. It's called financial exploitation. And a classic example is when a family member doesn't report a death or doesn't get help for an ailing loved one because they want to keep collecting that person's Social Security or pension checks. That's abuse, and you have a duty to report it.
Okay, this brings us to our final tool, and it's maybe the most important skill you'll develop: how to safely and clinically decode suicide risk. This is a heavy topic, but our goal here is to give you a clear, professional framework to assess the severity of the situation.
So when is the risk at its absolute highest? It's when you see this perfect storm. The person has a specific, detailed plan. They have access to whatever means they plan to use, and they're showing a very high intent to follow through. If they have a history of trying before, that raises the risk even more. This combination, This requires immediate action.
So what does moderate risk look like? Well, it's a bit different. Someone in this category might have suicidal thoughts, maybe even a vague plan, but they don't have immediate access to lethal means. And here's the important part. They still have protective factors in their life. Things like family support, future goals, a job, things that are keeping them tethered.
And then you have lower risk. Just to be clear, we still take this very seriously, but the immediate picture is different. This person might have passing thoughts, but there's no real plan, no intent, and no access to means, and their protective factors are usually quite strong. They're often willing to work with you on a safety plan, which is a great sign.
Okay, for all of you studying for your exams, or hey, for anyone who just wants a simple way to remember this in a high-stress moment, here it is. Just remember this simple equation. Plan plus access plus intent equals the highest risk. It's a formula that can help you cut through the noise and act fast when it matters most.
Okay, so that's the whole toolkit. We've covered a lot of ground, so let's do a quick fire recap of the biggest takeaways, the stuff you absolutely need to walk away with.
1. Screening tools are your friend. They make mental health symptoms measurable, just like vital signs. 2. For adults, restraint orders are only good for 24 hours and must be renewed in person by a provider. 3. You report when someone can't protect themselves or when there's an injury. And 4. The highest suicide risk is that combination of plan, access, and intent. And remember, this stuff isn't just about passing a test. This is about being a safe, compassionate, and really effective clinician every single day you're on the job. So I'll leave you with a question to think about. Now that you have this toolkit, which one of these tools are you going to focus on mastering first? Because that's where your real growth begins.